Hello, friends. I'm back after many days. So, welcome to Leading Characteristics. Today, I will talk about ALOE or Socotrina aloes, as it is commonly called. It belongs to the vegetable kingdom, the Liliaceae family. Now, we find it used mainly or principally in the gastrointestinal complaints. So, its sphere of action is predominantly the gastrointestinal tract or the GI tract. Now, what are the features that we have to keep in mind to know that the case needs allocytotrina? First of all, allocytotrina is a hot remedy. It is always aggravated in warm atmosphere or by hot application, and it likes or it is ameliorated in the cold. Number two, we have to remember that it has great flatulence, tremendous flatulence, sometimes making the patient breathless. There is rumbling in the abdomen, grumbling with colicky pain, cramp-like pain, very severe cramping pain, which is relieved by bending double, as we see in Colosine. So this is all due to this rumbling, grumbling, severe excruciating cramping pain or colicky pain in the abdomen, particularly in the region of hepatic region, that is due to flatulence or gas in the abdomen. Now we know Dr. Nashis has mentioned the trio of flatulence. One is carbovage for the upper abdomen when there is gas in the upper abdomen, lycopodium for the lower abdomen when there is flatulence in the lower abdomen, and China officinalis when the whole abdomen feels distended. In China, the whole abdomen there is a sensation of distension, fullness. But apart from that, when we study aloe, we see it also has tremendous of gas or flatulence and distension due to that. And there is rumbling, grumbling, and one characteristic here is that its pains and all are aggravated after any eating or drinking. We must remember this that after any eating or drinking, aloe has an aggravation, and immediately he or she has to rush to the washroom to pass stool, and after that passing, it can be a diarrhea, thin offensive watery stool, or it can be stool mixed with mucus. Different characteristics we have seen some patients, and sometimes we see there are hard lumps in watery stool, very offensive, and sometimes we find the patient has a after eating or drinking has to rush to the closet or the washroom, and it is passing nothing but gas, a flatus. There is urge many times during the day, and the patient goes, and nothing comes out but just flatus. And after that, there is some relief in the pain. After some time back, again same thing, and in this way, 2 3 days passes, nothing passes. So this type of constipation we see in alloson. And then, when the patient is unaware, then without any notice, means unnoticed, suddenly he or she realizes or someone else realizes that there is a stool, a lump, hard lump of stool has passed. In the case of constipation, we see like this. So this is another characteristic we see in ALOE, that involuntary escape of stool in the clothes, in the pants or whatever. So what is this? In dysentery it can be found, in diarrhea also, escape of thin watery stool. Even in constipation we find the patient or a child, as it's mentioned in the materia, we can find in chamber also, that the child passes small ball-like lumps. It is called marble-like balls, stool in the form of ball-like marble-like balls, hard lumps, hard balls like marbles. They are passed unnoticed. The child is playing, and suddenly the mother notices that it has passed some ball-like stools. In adults, in old people, we find aloe often uh, uh, means it comes picture of aloe. Even in children, we find. So these are the types of things we see, and we should remember this grumbling, gurgling while passing stool. There is spluttering noise or with rumbling in the abdomen. Soon after eating or drinking, passing of stool is there. After the stool is passed, the patient feels very exhausted and perspiration. So there is prostration and perspiration after passing the stool. Though there is pain is relieved, but this exhaustion is found. Tremendous exhaustion or weakness. So this is a feature of ALOE. And this involuntary escape of stool, not just involuntary, it passes unnoticed. If we see the repertory, we will see that there are many remedies which has this involuntary escape of stool. But in aloe, if under in the repertory, if you see unnoticed stool under rectum, unnoticed stool, we will find few remedies, comparatively less remedies, and there are just two remedies: unnoticed stool, stool hard, hard stool passing unnoticed. There are just two remedies: aloe and corrosive. Mostly we find this in aloe. Even hard lumps or hard stool passing unnoticed. There is another remedy. I will go there later. First, I will tell you what is the difference between unnoticed stool and involuntary. Involuntary means there will be an urge. Patient tries to control but cannot control. Patient tries to uh, don't want the stool to let the stool happen until and he is going to the toilet. But he cannot control. He cannot. The stool passes in spite of his best effort that it doesn't spoil or soil the clothes. But there will be an urge that is involuntary stool. But in aloe we find stool passes unnoticed, means there is no urge. Patient is not feeling the urge for stool. He is unaware. His mind is not fixed there. He is unaware, doing some work, and just then, without any notice, without the awareness of the patient, the stool passes. And the patient doesn't realize it. This is unnoticed. This is peculiarity of ALOE. Now, why this happens? This is because of the relaxation or the weakness of the sphincter ani. What is the sphincter ani? It is a circular a ring-like muscle at the anal opening, which prevents the stool from escaping. It has a voluntary control. Whenever we get an urge for stool, we can hold the stool until and unless we go to up to the commode or the washroom, and then we let the stool pass. So the operation of the sphincter ani, that muscular ring, is voluntary. It is under our control. But in the case of ALOE, that voluntary control is lost, and the sphincter ani just loses the control, or it goes open and the stool passes involuntarily. This is a very important feature of ALOE, even hard stools, and unnoticed. That is important part. So these first few points, as I told, hot remedy, full of flatulence, GI system disturbances, and there is another thing. There is a hot feeling in the hepatic region, burning, hot burning feeling, and along with the stool, as we said, it is very offensive. It can be thin, watery, or it can be thin, slimy, mixed with mucus. Generally, allosoft stools are mixed with mucus. There is mucus. Sometimes, with an urge, no stool passes, just lumps of mucus pass, followed by exhaustion or prostration. Patient feels very weak, and perspiration. And there is a excoriating burning sensation or pain in the anal, anus or anal opening, which is relieved by cold application. The anal pain is relieved by, or the burning is relieved by cold application. Next, the allosoc, another important, next important part is action on the venous system. The venous engorgement or fullness, as Kent mentions, fullness of the veins or the engorgement of the veins, mostly find it in the anal region, in the anal opening, where we see hemorrhoids or piles. Now, the characteristic or the striking feature of the piles of aloe is it is bunch-like. It is like a bunch of grapes. Now, what is that? A bunch of grapes. There are multiple piles, or multiple swellings. Three, four at the just at the opening, just together. Three, four swellings, bluish in color often we see, and there is a burning, fire, itching and burning. Now, now this itching and burning relieved by cold application, and there can be bleeding. Some often there is bleeding. We find apart from hemorrhoid, there is bleeding in allosocotrina, bleeding from the eyes, bleeding from the mouth, means along with cough, uh, hard cough, from itching in the throat, and the expectoration is bloody, blood tint. There can be bleeding from other parts. We find melena in allosoc. We find blood vomiting also. So, allosoc has an effect action upon the venous system, the fullness of venous system, the congestion in the hepatic region. There can be congestion, and there can be a hot burning feeling. This is another important part. All over this body, the skin feels there is a sensation of dry, hot burning, which is relieved by cold application or being in the cold. The feet can have a burning, hot feeling. So at night, the ALOE patient keeps the feet uncovered, puts them out of the cover. This is another part. So hot remedy, uh, flatulent remedy indicated in dysenteries, in diarrheas, even in constipation where the stool passes involuntarily unnoticed, there is rumbling in the abdomen, aggravation of pains, aggravation of the stool, diarrhea, or whatever, escape of mucus after eating and drinking. This you have to remember. And after it's passed, a little relief. The pains relieved by bending double, pains relieved by cold application. These are the things, engorgement of the veins. Now, bleeding from the bladder can be found, bleeding from the nose can be found, and another thing, that hot burning sensation. It is a part of ALOE. Now, if we remember all these points, we will be able to prescribe ALOE. Now, I will tell about a case many years back, a case of a abdominal chronic dysentery. In chronic dysentery, a person came who was weak, aged person, having flatulence, loose mucousy stool every time he eats anything, or sometimes a urge with tenesmus but passing only flatus. Now this person, he started this in during the months of May June, and after that he came to me 4 5 months later. So these were the symptoms: flatulence, rumbling, loose stool, mucosy stool after eating anything or eating or anything. Sometimes there is tenesmus but passes only flatters, soiling his dhoti. Every day this is happening. Now he was suffering gurgling in the abdomen with urge and he felt weak. There was weakness after in the when he passed stool in the evening hours. Mucus passed only, and after that he felt very weak. Initially, he had to rush to the toilet early morning. Just after his sleep broke, he had to rush. But after some treatment, some medicines he took, after that, this morning rushing, this went away. Other symptoms remained, and I prescribed him ALOE. And after ALOE high potency, he showed rapid improvement. So these were the features. Now, there are some differentiation I will mention here. Like it has a few other features, like in old beer drinkers. It is the Dr. Kent mentions, in old beer drinkers we find often ALOE this in its abdominal complaints. So another drug is there, that is, I think, Calibi. Now these we will find some confusion or some this differentiation should, I will comparative I will do here with some remedies. Like it has some similarities with lycopodium. Both have aggravation or from eating oysters. We know lycopodium has poisoning from oysters. Both have flatulence. Lyco 2 has flatulence. But the difference is that in aloe, In the oyster poisoning, if there is a case of poisoning after oyster, means some patients who cannot bear these oysters or this shellfish, they like they eat, and whenever they eat, they get a abdominal disturbance, tremendous diarrhea, and all these things. In aloe, the condition is very severe. The attack will be severe. Cholera-like condition can arise after an oyster poisoning or a shellfish poisoning. Extreme crampy pain will be there with loud gurgling, grumbling in the abdomen. Aggravation after every little food, has to rush to the washroom immediately. We can find in LIGO also, but the severity will not be like aloe. And LIGO patients find relief generally from warmth. Aloe find relief, particularly the burning in the anus is found relieved by cold application. In aloe, there is great exhaustion and perspiration after passing stool. In a LIGO, we don't find this. Then there are mental symptoms. If a chronic case we can find out some mental symptoms like then we, like symptoms, lycopodium like symptoms, we can give that. In aloe, the mental symptoms are very rare. What is told, one is that they are very irritable because they are very much dissatisfied with themselves. They are irritable, excitable. They do not cannot tolerate any contradiction, and it has been told they hate people, or there is a repulsion of people around them. They don't like. This is one striking feature: repulsion towards people. Next, about morning diarrhea. There is another. This is another area where often we can get a case of like allosocotrine, and there can be a confusion because there are many other drugs which has morning diarrhea. Like sulfur is there, natrum sulf is there, bryonia is there, podophyllum is there. So how to differentiate? When we see that sleep breaks from an urge, the sleep in the early morning breaks from an urge and the patient has to rush to the toilet, we think of sulfur. This is the nature of sulfur. Sleep breaking from an urge for stool and the patient has to rush. After the sleep breaks, then can't wait anymore and the patient has to run. This is allosocotrine. After the sleep breaks, the patient cannot wait anymore and he will have to run. Then it is aloe. After waking, as long as lying in bed, there is no trouble, no complaint. But as soon as he or she rises up and come out, gets out of the bed, he cannot wait any longer, has to rush immediately. That is bryonia and natrum cell. This differentiation must be, we must be able to do. If we can do this, we can find the correct remedy. We can prescribe the correct remedy. That after waking, as long as in bed, there is no trouble. But as soon as he climbs out of the bed, he can hold any no longer. He will be have an urge and he will have to rush. Bryonia, natrum cell. And podophyllum, this peculiarity that 4 o'clock in the morning, generally they get a urge, profuse, they will get the urge and they have to rush and there will be a profuse uh, ex- expulsion of stool, watery stool with gurgling, very offensive, and after the stool is passed, there will be profound prostration. Then, after some time again, and this a few times goes like this, and as the days progresses, the patient gets better. He feels better in the second part of the day. Again, next day morning, Same times he will have the same urge. He will go profuse gurgling, offensive stool, and with weakness. So this is podophyllum. Now difference between podophyllum and aloe, both have this gurgling, rumbling noise with profuse diarrhea, but in aloe there is amylation from cold application, there is exhaustion also, but offensiveness also, but this escaping unnoticed we don't find in podo. Aloe and Nux vomica both have these ineffectual urges. There is an urge, patient goes to the uh, toilet, nothing passes, just flatters. He comes back after the flatters, there is little relief. He comes back again after some time. This we can find in aloe. And with this belching and gastric complaints and all, this is also found in Nux vomica. But Nux vomica patient is chilly and the aloe patient is hot. It wants cold. Aloe finds relief from cold. So friends, these things if we remember, we can easily prescribe aloe SOCOTRIN. Thank you so much. I will be up with another drug next week. Thank you.